Good morning, South Florida. I'm the Maestro. I'd like to say good morning to you. I am sitting in for Super Cindy on Community Matters, and I have a special guest here that you should be, I think you know her very well. But I'm going to let her introduce herself, and I will let her tell us more about it. Good morning.
Thank you for having me. I am nurse practitioner Dr. Katina Kennedy. I'm a certified family and psychiatric nurse practitioner. I've been practicing since 2007. I have my own medical practice in Coral Springs, Florida, in which I provide a multitude of services: primary care, gynecology, women's health, men's health, teen health, and also, of course, mental health and sexual health as well. I love what I do. I'm also an author. I have quite a few books that's out regarding teens. Let's Talk Sex and STDs, the student edition. Also a television and radio health expert. So you may have, seen me with various, and heard me on various outlets. And I'm also a professor as well. I teach at various universities, adjunct instructor. And I'm also an entrepreneur. I have my various products that I offer, and I'm excited to be here.
Well, it's glad to have you here. Let's dig into this. Let's go a little deep about what you do, because this is something that is going on now. Well, I think it's been going on for a while. You're a doctor, you know this. But I think people is talking more about it more than ever. Mental awareness. But you're dealing with something that's totally different, too. Share with our listening audience about what you deal with when you talk about the practice that you're in. You deal with dealing with kids.
Yes, teen health. You got it. So, mental health is very, very important. As you know, mental is just as important as physical health as well. And that's why I decided to, just when I created my practice, I actually wanted to create my practice in a way that I provide affordable care and multi-specialty as well. So meaning that I wanted to be able to take care of all ages, but specifically my teens as well, and women and men, but teenagers, teenagers. As you know, if you think about back in the day, mental health wasn't so popular,
No, not whatsoever.
Yeah, it wasn't so popular. If we did deal with traumatic incidences, we kind of swept it under the rug, or culturally, a lot of Black families and Caribbean families, they just said, oh, you must be got a devil inside of you, or, you can get that demon out, or, you get just various things, and not addressing the issue at hand. But nowadays, I can tell you, these teenagers are more about their mental health, and I'm excited about that.
And one thing I'll say as a grown man living on this universe is that when a Black person come to you, they were ashamed to talk to you about it.
Yes.
Now it's more like, okay, I see this superstar, I see this basketball player, I see this doctor, this judge, whoever is talking about mental health. Okay, if they having situations like this, it's okay for me to talk about it.
Yes.
So can you get into detail why we as Black people would do that? Is it because we just didn't know any better, because we were ashamed, or what?
I think it's culturally, just cultural. Like growing up, our parents, even our parents didn't even talk to us about sex. We didn't have that conversation. It was just like, use a condom and that's it, or don't get pregnant and that's it. Nobody really sat down and just talked to you about the importance of your mental health and physical health. But I'm around COVID. That's when I noticed an influx in, persons interested in mental health. Because I think, when things shut down, anxiety increased, because people couldn't go outdoors. And so anxiety increased, depression increased, and people realized that, what, something's going on with me. And so during COVID, that's when we saw a spike in people coming in and reaching out for help. And that's what's important. And I'm glad about that, because they noticed that they were having some of those symptoms, such as, let's just say, just short-tempered, angry, just feeling so on edge, increase. And then you have your physical symptoms as well.
Let me ask you a question. Do you think COVID had a lot to do with this mentally?
Oh, yes. Because remember, so many people are used to like going outside, going outside for work. And so when COVID happened, you were just inside. And it was lack of education on what COVID was, but, just being inside, a lot of people didn't know how to handle that.
I could say this for one because we work from home. I was so glad to go to the mailbox.
Exactly.
I told my neighbor, I said, I feel like I was going to a field trip because I can't. I don't know how a person want to go to jail.
Yeah, yeah. Yeah.
It'll drive anybody crazy.
Yeah, even my patients who work from home, like today, just in general, like just because we're outside now, but those who work from home, I tell you, you got to get outside. You got to go for a stretch. You got to go for a walk because, it really takes a toll on you. It suppresses the hormones, So
Well, not only what I found out for myself, going to my own doctor is that I was getting stressed. My whole neck was hurting. And he said, you're sitting down for 8 hours. And your head is like this for 8 hours. And I began to find out I got to get up.
Yeah.
He said, you got to walk away from that computer.
Yes.
And all the things that we experience. And tell me as a doctor, what have you experienced dealing with different patients during COVID?
So during COVID, I've had patients that had panic attacks. So they came in with chest pain. They had shortness of breath, and they, would go to the ER, and the ER would say, hey, your heart is good. You're not having a stroke, because they were also experiencing numbness and tingling to the left side of their face, loss of feeling. So for right reason, they went to the ER. But once the ER said, you're not having a stroke, you don't have a heart attack, they say you're just having anxiety. Patients was like, wow, really? Anxiety produces those symptoms? Because a lot of people didn't realize that not only do you have mental symptoms of anxiety, but you have physical symptoms as well. So I had patients also that came in. They experienced just paranoia. They've never been so paranoid because of, again, lack of education about COVID, right? So they were like, okay, so can my partner come over? Can we engage? Can I kiss this person, or can I be around this person? So they were having a lot of paranoia, chest pain, shortness of breath, nausea, vomiting, irritable bowel syndrome, diarrhea, going to the bathroom a lot, or sometimes their bowels even locked up, some constipation.
Really?
Because they're those are the bodily physical symptoms that people may have. And then let's not talk about the lack of sleep. Because the mind, those thoughts, the racing thoughts, right? The worrying. If you did come in contact with someone who had COVID, okay, then that's when okay, what's going to happen to me? Or I hope I don't have to go to the ER, or what symptoms and so forth. So, patients really experienced a lot of those symptoms. And I think it also brought self-awareness as well. Patients realize that these are, some symptoms that I'm having, and I need to get help.
Let me ask you another question here. Let's talk about mental health and awareness on the job. I think it takes a lot of toll on people. Pressure on top of pressure. We begin to do more than one job. And we begin to do another job that's added on to another job.
Yes.
Do you see a lot of that come into your office, people talking about that?
That's a big one. I'm so glad you asked that question, because that's like the number one complaint that I actually see. When patients come in, they're like, I don't know what to do. I can't concentrate. I can't focus. I have scattered brain. I'm unorganized. I'm getting really nervous and scared at work because I'm overwhelmed. I have so much I have to do. And so because once persons become overwhelmed, that anxiety increases. And then they become depressed because they're not able to carry out their duties. They feel like they're less than because of being overwhelmed with the job stress. I am a big proponent of self-care. I will take somebody off from work quick. You have to take a mental health day off. You have to take care of yourself. Self-care is so important. I always say, this is my mantra. In order to carry out your purpose and passion in life, your duties, to be that great employer, to be that great employee, to be that great leader, caregiver, mom, dad, sibling, whatever you may be, you have to take care of yourself first. Because if not, how are you going to carry out your purpose and passion in life and then your job duties as well? So it's okay to take time off for you. It's okay if you don't want to go in that day, because when you go to work, guess what? Your boss going to want you to perform how you're supposed to perform.
Got a question I want to ask you.
Uh-huh.
You brought up the word boss. Do you think bosses, leaders, should take a course from people like you? Because we take it wrong that we're a boss and we're not looking at the physical, the mental of the people that we're supposed to be leading. What's your take on that?
Yes, definitely. I think there should definitely be a course on, or just some type of education, somebody to come out and just focus on organizational culture, just making sure you create a culture that facilitates self-care along with productivity as well. So, a lot of leaders, they focus on what we call transactional leadership. Hey, this is what I want you to do. This is what you do. This is how you do it, versus transformational, meaning just really, engaging the employee into different job duties and so forth, and just making them a better person, allowing them to be creative, be engaging. But going back to the question, I think leaders should definitely be sensitive. To be sensitive and competent to mental health, and just promote self-care, having fun as well. Because if not, the retention may wane. The patient, the employee may feel like, they're not warranted. They're not.
Let me ask you a question. Have any corporation have come to you or call you and said, we want to hire you to help us do the right thing for our employees?
I haven't had a corporation to do that as of yet. However, I have had corporations to hold like employee health days.
Okay.
So they had me to come out and speak to their employees on various things that they can do to enhance their lifestyle. So, and I do that quite often. I go to corporations and just talk about, various chronic conditions that affect men and women, and then also just the importance of self-care. So I've done that, but not particularly the question you asked. But that's a great idea.
I think they need to do that.
That's a great idea.
I think corporations need to invest into their business and their employees.
Yes.
And hire someone like you.
Yes.
But I want to go to another question here. The other question is, how do we learn how to identify somebody that we're close, husband or wife, son or daughter? How can we identify? What are the things we should watch and say, wait a minute, something's not right there. Let me call the doctor.
Great question. Oh, and this is so important, because being aware of how your loved one, how they feel and the changes that they experience is key. Not only important to the relationship, but to the family dynamics as well. So if you notice the person has changed, like if they're becoming more short-tempered, agitated, they're snapping off of everything that you say.
Right.
You're like, I didn't do anything. What's wrong? Or if they're crying or becoming more isolated than usual, they're not going out like they used to. They don't find any interest. They're not happy when they do the things that they used to do. When you notice that they're overeating or undereating, those are signs and symptoms of something's going on, maybe some depression. Also, when you notice they're not sleeping well, they're tossing and turning, they're up all times of the night. When you notice that they may be gaining weight or losing weight, see, you got to pay attention. When you notice these things, do something, say something, but when you talk to the person, you got to be sensitive. When it comes to, telling a person, you notice some things. You got to say it's how you say it, right?
I'm glad you're saying that because a lot we don't know, and that's why it's so important that we have someone like you to help educate, including me, our listening audience. We don't know.
Yeah.
Don't think we know. We
Yeah.
don't know.
Yes, yes. So it's how you say it,
Mhm.
and when you say it as well. So
Mhm.
sometimes just, let's say for instance, if you notice something has been going on, maybe over dinner, or a pillow talk. You had a nice time, or the environment is nice, it's positive. Just have that conversation. Just say, hey, let's have a talk. I notice, you've been feeling this way or acting this way. Tell me, how can I help you? I have a couple, people that I can reach out for you.
Mhm.
I have some therapists, or, you can go see nurse practitioner Dr. Katina,
There you
and,
go.
she'll point you in the right direction. She can help you. But I think you really need to see, someone, because I feel like something's going on. And then, first things first, though, I do want you to get your physical exam, because there could be something internal that's going on. So we have menopause, we have perimenopause, we have low testosterone in men. So when they experience like depression or low
Oh, that
energy,
causes that?
low testosterone. Yeah, yeah. So all of
Fellas, y'all hear that?
so not just, because when you hear low testosterone, you're thinking about, erectile dysfunction. However, men have what they call hypogonadism, which is low testosterone. Not only just the inability to perform sexually, but you go through changes. You actually feel down, low energy. You don't feel yourself. You're feeling depressed. You're feeling sad. A lot of my patients use the term blah. I'm just feeling blah. They really can't describe it, but they're feeling blah. They're just not as energetic how they used to be. So when you come in, we check your testosterone levels. For women, for men, we also check the thyroid for men and women. And then check you for anemia, because low blood can cause, mental issues as well. So you have to get your physical exam, your annual physical. If you haven't had your physical throughout the year, this is a reminder to go get your physical. That is important.
Let's talk about physical.
Mm-hmm.
How many times a year you should go get your physical?
Uh,
We as men is bad. I can tell you that. And knock on wood, I at least go 3 times a year.
Okay.
So cause I don't play.
Yes.
I feel like a pain coming. I'm going.
I like that.
So, but explain to our audience how often you think they should go, men and women,
All right. So
and kids
you
too.
got it. So definitely, all ages, you should at least go once a year for your yearly physical exam and blood work. Make sure your provider do your blood work, because the blood work is going to tell us what's going on the inside of the body. Now, if you have chronic conditions like, diabetes, hypertension, high cholesterol, then you may want to go every 6 months,
Gotcha.
depending on how controlled, your conditions are. And then if it's not controlled, then I have my patients to come in, especially with diabetes, come in every 3 months, because we have to see how that hemoglobin A1C is doing, to make sure, it's going down, which is the right direction. And then for those of my teenagers who are sexually active, young adults, older adults who are sexually active, who are single, you want to get your STD checked. You can't forget about sexually transmitted infections. So you definitely want to get that done, every 3 months, every 6 months. If you're changing partners, a new partner, have your partner to get tested as well. We can't shy away from that topic as well, because, like I say, mental and physical, both are important. They go hand in hand. You notice just a few minutes ago, I just mentioned how when we have depression or anxiety, how it affects you physically. Blood pressure. I have patients, you hear that term that say stress kill. That is so true, because what happens is when you are having anxiety or what we call acute stress reaction because something has happened, the blood pressure can shoot up. And because you're not on any medicine, persons can have a stroke or a brain aneurysm. So it's just so important to just pay attention to yourself. don't ignore the symptoms. I just gave you some hints there. Don't ignore the symptoms. Know your health status and just make sure you get checked out and go get help. Don't ignore it.
So let's talk about blood pressure. A lot of people don't know when their pressure is good and when their pressure is high. Break it down for me, Doc.
That's why they call it the silent killer, because you don't know. So for those who follow me on social media, they know I have something called Blood Pressure Tuesdays. And this is just to remind my followers that, you know what? It's time to do a spot check on your blood pressure. Even if you don't have high blood pressure, just go. You can go to, people forget that the pharmacist, you can go to CVS, Walgreens, any pharmacy. The pharmacist can check your blood pressure themselves. Or you can go and use the machine, or if you have a machine at home, check your blood pressure at least once a week. Just to check in, like if you don't have high blood pressure, or if you do have high blood pressure, even if it's controlled, you want to check your blood pressure because it's a silent killer. Some people are fortunate to get headaches, dizziness, feeling kind of foggy brain is what they call it. They feel different. But then some people, they function well. And that's not good because if the blood pressure is not controlled, it enlarges the heart. It damages the kidneys because that's how people end up on dialysis because the heart has to work extra hard. And then you get congestive heart failure. So you go in. I've had patients followers and patients, they saw that Blood Pressure Tuesday. And I had someone to inbox me and they say, wow, thank you for that. I just randomly checked my blood pressure because I hadn't been to the doctor's office in a long time. And my blood pressure was 200 over 100.
What?
Now, just to remind you all, the blood pressure should be, the guidelines say it should be less than 120 over 80. If it's greater than that, you have what they call pre-hypertension. And then if it's 130 over 80s, we start to say, you know what? You need to monitor that. So 200 over 100 is really high. And she said that, she went to the ER because it was so high. And she said, wow, you saved my life. I could have had a stroke or, they found some blockages in my heart. Speaking of that, if you are over 50, if you're 50 and over, I do highly recommend you go for your heart check. If you haven't had a stress test, if you haven't had an echocardiogram, which is an ultrasound of the heart, you need to go get your heart checked out because that's another silent killer. You don't know until you have a heart attack if something's going on. So preventative care is key. I'm big on go for your screenings. Stop going in just when something's going on. Just go in preventatively.
I want to say thank you once again. Give them your phone number where they can call you. Give them your email again, and then we'll wrap this up.
All right. You can reach me at 954-231-8700. My website, drkatinahealthandwellness.com. And you'll find all the information there regarding my services and, ways to book an appointment. And it's important that, you work on you. When you notice that, there's something going on, just remember, it's nothing like peace within yourself, bringing peace within yourself. If you're stressed all the time, on edge, anxious, that's not how life has to be all the time. Of course, we're going to have those triggers, right? Yeah. Those overwhelming days, but it should not be like that every day. So you have to focus on ways to enhance peace within yourself because that's so important.
You heard it from yourself. Dr. Katrina has told you what you need to do. I want to say thank you. This month is May and Mental Health Awareness Month. I want to thank you for coming again. I'm sitting in for Super Cindy on Community Matters, and Dr. Katrina, I want you to come back.
I sure will. My pleasure.
All right. We're going to wrap this up. You've been listening to the Maestro sitting in for Super Cindy on the one and only Community Matters.